In fact, in my practice, I have personally seen women conceive and give birth without complications, even with tiny little fibroid growing inside their uterus. Today, I will be telling you about the role of vitamin D in the treatment of fibroids. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility physician, and my channel focuses on everything fertility and women's health. So if this is the kind of content you're interested in, keep watching. First, I'll be explaining what fibroids are, causes of fibroids, and all the available treatments for fibroids. Fibroids are benign. Benign simply means it does not cause cancer. It is a growth that arises from the muscle of the uterus, from the muscle of the womb. It is very common among women of childbearing age, and it occurs in all races, but it is more common in Black women. Studies have shown that about 20 to 80% of women will develop fibroids before the age of 50. Simply put, out of every 10 women, about 2 to 8 women will have fibroids. It is important to remain calm when you're first diagnosed with fibroids because it is not always a serious diagnosis. It is not a death sentence, and it doesn't always lead to infertility. Don't worry, I'll be telling you how and why. You see, out of every 8 women with fibroids, about 4 of them will be living normal lives. They'll be going about their daily activities. They will not need any form of treatment at all. It is possible to get pregnant with fibroids. All you need to know is the location of the fibroid. And that's because fibroids can grow on different areas of your uterus. When it grows inside the womb, it is called submucous fibroids. When it grows within the muscle of the uterus, that's the womb, it is called intramural fibroids. And when it's growing on the outer body of the uterus, it is called subserosal fibroid. The one that grows within the muscle and the one that grows on the outer body of the uterus will not affect fertility. It will not prevent you from getting pregnant. But it is possible for that one that is growing inside the uterus to affect fertility because it is growing where the embryo is supposed to implant. This is not an absolute fact. Some studies have shown that it is possible for the baby to implant even when there is a fibroid growing inside, as long as there's enough space for it to implant. The idea behind this is that if the embryo decides to implant where the fibroid is sitting, it will fail. But if it finds somewhere else, like the opposite side of the inner uterus, it will be able to implant. If implantation occurs with fibroid inside the uterus, sometimes the pregnancy hormones can cause the fibroids to grow as the pregnancy is growing. And because both the baby and the fibroid are sharing the same enclosed space, they will start competing for space. And this could lead to the death of the baby inside the uterus. So when you're diagnosed with fibroids, ask your doctor to tell you the location of the fibroid. Remember, I explained that it is not every fibroid that is growing inside your uterus that will cause infertility. In fact, in my practice, I have personally seen women conceive and give birth without complications, even with tiny little fibroid growing inside their uterus. It is just that the pregnancy will require close monitoring during antenatal care. The exact cause of fibroid is still unknown, but there are some factors that have been linked to fibroids. They include 1. Genetics. Some women are just genetically predisposed to fibroids. The next one is race. Studies have shown that Black women tend to have fibroids a lot more than white women, and the reason for this is unknown. Also, prolonged exposure of the uterus to a hormone called estrogen has also been implicated. So it is said that if you see your menstruation too early in life, that is, your very first menstruation, or it takes you a very long time to get pregnant for the first time, then it could increase your risk for fibroids. Because in these 2 cases, your uterus would have been exposed to estrogen for a long period of time at a stretch. Fibroids can be treated with medications that block estrogen hormone, but because of its side effects, its many side effects, it can't be used for a long period of time. Some other studies have shown that lack of exercise have also been implicated alongside vitamin D deficiency. So if vitamin D deficiency, that is lack of enough vitamin D in the body, increases the risk of getting fibroids, shouldn't vitamin D supplement prevent you from getting fibroids or even treat it? So there was an observational study that was done for 5 years on 1,600 black women. They monitored their vitamin D levels regularly and performed frequent ultrasound scans to determine if they had fibroids and how much the fibroids grew over 5 years. About 75% of the women that had fibroids had vitamin D deficiency. With time, some of the women who had fibroids didn't have fibroids anymore. The fibroids had disappeared because when they were scanned, the fibroids were no longer there. But the disappearance of these fibroids happened in women who had higher vitamin D levels. Some other studies show that when vitamin D is added to fibroid cells in the lab, the cells stopped growing completely. While some other studies show that vitamin D reduces the size of the fibroids, it shrinks them. While these are very good studies, they are still inconclusive. However, vitamin D is a cheap and safe choice. In women trying to conceive, it is usually recommended that they add vitamin D to their prenatal vitamin because studies have shown that women who don't have enough vitamin D in their body have reduced chances of success with fertility treatments. So for more information on the dosage of vitamin D that is recommended prior to conception, check out my video on supplements for women that are trying to conceive. In addition to vitamin D supplements, if you are vitamin D deficient, there are sources of vitamin D you can explore, such as sun exposure. The primary source of vitamin D is sunlight. Spending time outdoors and exposing your skin to sunlight, especially during the midday hours, can help your body produce vitamin D naturally. Dietary sources also, like from fatty fish, like salmon, mackerel, they are good sources of vitamin D. Cow milk as well, sardines, egg yolks, mushrooms, all of these diets are good source of vitamin D. So how do you know you have fibroids? Most times you don't, because you may not have any symptoms. You may only find out when you go for a routine gynecological exam. However, some women may experience symptoms like heavy menstrual bleeding, sometimes with clots, painful menstrual bleeding. Sometimes they can grow very large, that's the fibroid, and can cause feeling of heaviness in your pelvis. And because the fibroid is sitting in between your bladder and your rectum, which is behind, your bladder is in front, your rectum is behind. If it grows too large, if the fibroid grows too large, it can press on your bladder and cause urinary symptoms like frequent urination. Then if it presses on the rectum, it can cause constipation. Although there is a definitive treatment for fibroids, like surgery, practicing healthy lifestyle of balanced diets, exercising, outdoor activities for sun exposure, foods rich in vitamin D can be beneficial in helping to prevent fibroids. And hopefully, with more research, we will have a definitive medical treatment that does not require surgery. As usual, I am wishing you the best on your fertility journey. If you found this video informative and you want more content like this video, subscribe to my channel, share with your friends, and see you in my next video.